take advantage of your second and third attempts, okay? Reason being is out in the medical field, you will have school physicals, you'll have Medicares, you'll have work physicals, and they may need a PPD, a vaccination, and the vaccination may be intramuscular, but it may be subcutaneous, or they need an allergy med. So you will have instances where you need to do all 3 injections, okay? So first attempt is for me to kind of gauge and make sure that you have the concept of intramuscular, subcu, and ID separately, okay? All right. Now, with intramuscular, there are 3 sites we're going to focus on. There are more than 3, but we're going to focus on 3, okay? 2 of which you're going to have to use critical thinking to know which one you need to choose with the medication that you have or your scenario that is given to you, okay? The third one we're just going to talk about because you will see it on the board exam. It is not used out in the clinical area, but you will see it on your exams, okay? Even like the big state board exam, okay? So the one that we will not be using, but we will be talking about and you'll be tested on is the dorsogluteal intramuscular area. And that is going to be on the back side over here. Now, the reason they've gone away with it is because apparently there's been a lot of sciatic nerve damage because your sciatic nerves runs right down your leg, and that is a major vessel. So they've replaced it with ventrogluteal. Your ventrogluteal is going to be around the hip area, okay? And you have a right and left, okay? That is gonna be the big muscle that we're gonna work on. Now, what goes in big muscles versus a small muscle like deltoid? Deltoid's the third one we're gonna work on, okay? It's considered a smaller muscle, so it only takes smaller amounts of medication and medication that isn't irritating to the tissue and not viscous, okay? Who knows what viscous means? Exactly. Viscous means, viscous refers to the consistency of the medication you're using. So if something is viscous, it means that medication is very thick and just maybe it has particles in it, okay? This right here, Rocephin, this is a viscous medication. It's powder, okay? This needs to be reconstituted, okay? So you would use the diluent that comes with it, clear to cloudy, to make Rocephin, okay? You will not be doing that for your skill, but it is something that you will be doing out in the field, okay? So where do you think that would be administered? Deltoid or ventrogluteal?
In the gluteal?
Ventrogluteal. No, because it's thick, it's viscous, okay?
Yeah.
So large amounts of medication go in bigger muscles, thicker medications go in bigger muscles. Small amounts of medication goes in deltoid, thinner medications goes in deltoid. Now we're gonna be working with like vitamin B12, okay, as a deltoid injectable. That's the color red, but it doesn't mean it's thick, okay? It's still thin, it's watery. So, and it's given in smaller doses, so it's going to go in the deltoid, okay? Your antibiotics, okay, those are like milky and like creamy, like lotion, okay? It's really thick. That's gonna go in ventrogluteal. Your steroids, same thing, it's thick. That's gonna go in ventrogluteal. Same thing with testosterone. Testosterone is like a gel, okay? That's gonna go in a bigger muscle, okay? The majority of your vaccines will be deltoid, okay? All right, so I'm gonna go ahead and prep deltoid and ventrogluteal. I'm gonna show you placement of deltoid, and then I'm going to send a text message to Mrs. Pearson she's gonna go ahead and do ventrogluteal. I was taught in school, and I've always done dorsogluteal. Not that I haven't taught ventrogluteal, but she's actually currently working in a clinical setting and does ventrogluteal injections all the time. So she has more recent, better tools to show you guys, okay? So I'm gonna have her do that part when I go in to demonstrate, but I'm gonna start with deltoid start to finish. Now, before I go there, in your PowerPoint slides, it does also explain which medications would be used for bigger muscles, so that you have a better idea of when you get your scenario, what it is that, which muscle you're gonna be using, okay? So I may give you vitamin B12. You can ask, is this viscous or non-viscous, if you're not familiar with the medication. And that's how you know which muscle you're gonna go in. So if I say non-viscous, deltoid. If I say viscous, ventrogluteal, bigger muscle, okay? And that'll help you know where to go, okay? But if you're familiar with medication and you know, and you don't need to ask, and you go to the right muscle, then that's good too. Like azithromycin, antibiotic, amoxicillin, antibiotic, okay? Those are big muscles. All right, so we'll go ahead and get started. So just like with eye, ear, oral, I'd have you do your calculations, but the difference is with this one, I'm gonna have you do your calculations for all three. So we kind of get that out of the way. Then you'll bring your calculations up here. That also has your doctor's orders and what's on hand. And we're gonna start with the setup. So I'm gonna phone.
Sorry, I'm in my way.
So I'm gonna pull one alcohol swab for my vial and one for my patient, okay? I'm gonna get some gauze and I'm gonna grab a Band-Aid. We're gonna be doing both, so I'm just gonna pull out two of everything. Okay, so I've prepped my area. Now I'm gonna go ahead and look for my medication. So I'm going in the deltoid. So let's see, vitamin B12. So just like with eye, ear, oral, you have your 3 checks that you have to do. So this is my first one. And the top of the vial. Okay, that was my second one. Now I'm gonna look for my syringe size and my needle size. So for intramuscular deltoid, what size syringe am I gonna need? Syringe. There's only 2 that we talked about in lecture. 3 millimeters. So for your intramuscular, both intramusculars and subcutaneous, you're going to use a 3 millimeter syringe. Okay, this is the only one you're gonna have available.
What's
5. And then this one is PPD, it's 1 ml, but you'll be able to set this one aside and know this is PPD. So we'll talk about that later. So got your 3 ml syringe. Put that on the side. For deltoid intramuscular, what's the needle size? Who can give me the length?
Point
No, the length.
of the needle, 0.1 to 2.
That's gauge, and that's going to be for intradermal. For intramuscular deltoid, we have 21 gauge, 1 inch for a drop, and then we have a 25 gauge, 1 inch for administration. Okay. And the way we can tell the difference between what is a draw-up needle and what is an administration needle is your draw-up needle does not have a safety on it, okay? Your administration needle has a safety on it, okay? So we're gonna go ahead and pull our needles out. What I'm gonna be looking for, because the gauges may change depending on availability, is the length. Are you choosing the correct length? So for deltoid, we're gonna be using 1 inch, okay? The range is typically 1/2 inch to 1 inch. We're gonna be using 1 inch, okay? And then the gauge range is anywhere from 21 to 25. So I have a 21 administration and a 21 drop and a 25 administration. So that works, okay? Both of them are 1 inch. Now for my ventro, I'm going to need a 22 1.5. It needs to be longer because we're going into a thicker area. We need to make sure we get to that bigger muscle, okay? So regardless of the gauge, it needs to be 1.5 inches long, okay? This, for ventro, we have a 22 gauge. Now, for the prep needle for ventro, all I have is a 1 inch. So since we're only prepping with this needle, you can use a 21 gauge, 1 inch to prep your ventrogluteal, and then this one to give to the patient with, which is the 1.5 correct size, okay? All right, so first let's go ahead and continue finishing deltoid. So I went ahead, did both my verifications. Gonna go ahead and start preparing my needle. I'm going to keep everything in my hands. I'm not going to set anything down so I don't break sterility. Remember, I have to use sterile technique and medical asepsis together. I'm gonna remove this from a packaging, open up my draw needle, didn't break any part, everything is still sterile in there, okay? Now, I cleaned off my vial. I have to break the vacuum, so now I need to draw up my dose that I calculated in air first. Okay, so let's say it was about 1/2 mLs, okay? So this is what a 1/2 ml drawn up would look like. It's that line right there. See how there was like 2 lines on the plunger? And there was a cone, so we're not going by the cone, we're going by that line right there.
The cone?
Yep, the base. So this is a 1/2.
Okay.
Okay, that's a 1/2. So it's that's a 1/2. We are not using the cone.
Two cameras.
We're using that line right there. Not
You
this
would be like, I
one.
can't flick you off.
Yeah, the first line. The base of that. I'm gonna remove my cap. I'm gonna take my cap and just lay that in the tray. It's okay to do that. I'm gonna go ahead and puncture the rubber stopper, put in my air first, flip it over, and just like with the ampule, you'll have what's comfortable for you as to how to hold the vial and the needle together, okay? Some wanna do this. That's okay too, okay? So you'll find what's comfortable for you. I'm gonna do this. So if you noticed, the vacuum already kind of pushed my plunger, okay? Because it already knew, because I put in 0.5 mLs of air, and it was like, all right, so you're gonna draw about 0.5. So we're gonna help it out. I'm gonna go ahead and pull back slowly. Now I'm going past my 0.5 because there's some air at the top. So I'm just gonna push that air out of the needle and get to the 0.5 that I need, okay? So once I'm there, I probably have some bubbles I need to remove, okay? I'm gonna keep my needle, my syringe in the vial and remove the bubble. Why don't I take out my needle and remove it that way? What could happen?
You can use more medication.
I could lose more medication, which, what happens then?
You gotta start it.
My dosage changes, okay? So if I keep it in here and remove it, if I notice that my dosage changed, I can fix it, okay? So you really can't fix it when you're out tapping things out, okay? And then medication gets everywhere and it gets messy. So you wanna keep it in the vial, okay? So this is what a bubble looks like. Those tiny ones. Okay.
You wanna
Move these pesky things. You're going to tap it right on top of it, okay? Not off to the side, not on top, not whatever. And if you get a good strong tap at the beginning, that's all you might need, okay? Or maybe two. You're gonna use the bed of your nail. It is sensitive, but you'll get used to it, okay? I get asked a lot, does it still hurt, Miss Aspar? Yes, it still does, but I'm used to it, okay? So, when I take it out, my bubble's right there, I'm just gonna, and it's gone, okay? Just like so. Make sure that my plunger didn't move after I do that, you know, it's fine, my dosage is correct, I'm gonna remove it. Again, 1 hand scoop. If there's too much going on here, I don't wanna contaminate, so I can move my cap to an area, put my hand back, 1 hand scoop, just like so, from the base of the cap. Make sure it's secured. Before I change my needle, I'm gonna do my last check, so I don't forget. Okay. Now I'm gonna change my needle. So I'm going to open the end of the hub away from me, so I don't wanna touch that. I'm gonna unscrew this. Sharps, just like so. Take that off.
okay, because the first one is just to draw
Pull
it
that
out,
back.
and the second one is to put
This is what we want, a fresh needle to inject into the patient. Because think about it. Do you want something that's been through a rubber stopper that's gonna dull the point out a little bit going in? No, you want something that's gonna be the least painful and glide in real quick, right?
Gotcha.
So pull the safety back. First one done. Put that off to the side, okay? And I did all my 3 checks, so I can put that back. Now I'm gonna go ahead and prep my ventrogluteal, okay? Now this one, I'm gonna kind of run through the steps because the process of preparation is the same. Needle sizes will be different. Syringe will be the same, okay? All right, so it looks like zithromycin is what the doctor ordered. I have my 3 ml syringe. My prep needle is 21 gauge 1 inch. My administration needle is a 22 gauge 1.5 inch. Bigger muscle, bigger needle, or longer needle. Keeping everything in my hands. So it looks like my calculated dosage was about 1 ml. Put my air in. Inject that first. And then over here. I'm gonna go past the 1 ml to get that air out. So I'm gonna push that out, push it back to 1. Get that air bubble out. Nothing there. Come back over here. All ready to go. Okay? When you're doing multiple injections, if you end up having to do that, you can come over here and write on the paper towel and say, all right, this one is going to be deltoid, 0.5 ml, and then this one's going to be ventro, 1 ml. If you forget to write it down, your needle sizes can be your indicator or the dosages, okay? I know my deltoid is 0.5 ml, and I know that it's only a 1 inch. This is a significantly longer needle. I know this is gonna go in a bigger muscle, and it's a 1 ml, okay? All right, so I'm all set to go. Excuse me. Take my orders, and I'm gonna go see my patient, okay? Now come in. Hi, Ms. Smith. My name is Ms. Jasper. I'll be your certified medical assistant today. Looks like the doctor ordered a couple of injections for you. Before we get started, can I get your first and last name with spelling, date of birth? Thank you very much. So it looks like there's 2 injections that'll go in your muscle. One's gonna go in your arm, the other one's gonna go in your hip, okay? Before I get you ready for this, I do need to make sure that you are not allergic to either of these medications. Do you have any allergies to vitamin B12? No? Okay. Do you have any allergies to azithromycin? Okay. Again, you have to double check those medications, make sure there's no allergies. Any other allergies I need to be aware of? No? All right, so we'll go ahead and get started. I'm gonna go ahead and inject your arm, and then I'll have another MA come in to do your hip, okay? Okay. All right, so I'm gonna go ahead and get my gloves on. I'm gonna need a volunteer. Go ahead.
Wait, am I getting stuck?
No, I'm not gonna stick you
Oh,
for
okay.
real.
Sticker. No, I'm just kidding.
My social media.
So, for me to have everything ready, I always like to, and you don't have to do this. This is just something that I learned by seeing, other people in my station and kind of on my own. I'll open the Band-Aid halfway, just like that. Take my gauze, stick it on there. So that way it's already ready. So after I'm done, I have it quickly and I'm not looking, okay? Because sometimes, they may bleed a little bit, and you guys have all had injections. Sometimes you can feel it dripping down your arm, right? So, all right. Next thing I'm gonna ask my patient is, do you have an arm preference, right or left?
Left.
Left, okay. So I went ahead, opened my eyeball swab. I'm gonna come over to the patient's left side. Go ahead and, if you don't mind pulling your sleeve up for me and holding it so that it doesn't fall. Okay. So I'm gonna look for the top of her shoulder, okay? And then I'm gonna put either my pinky or my ring finger, whichever. And I'm gonna drop 1 to 2 fingers. So this is 1 finger, this is 2 fingers, okay? I'm gonna go ahead and do 3. So this is where I would inject, okay? This is the deltoid muscle, it's a triangular muscle, okay? And this is the area. I'm avoiding any moles, tattoos, birthmarks, lesions, and the reason we do that is to also avoid any blood vessels, to make sure that we're only going into the muscle.
What if they do have a
I was
tattoo?
about to ask that.
You would need to find an empty space. Sometimes there's empty spaces in them, or you check their other arm and talk to them. Say, all right, I may have to do the other arm because we can't inject it into the tattoo.
Because
Okay.
some people are.
A lot of tattoos are on the shoulder, yeah.
Well, I mean, if they have like a blanket sleeve on both arms, then obviously
Just prick them.
you just have to do what you got to do.
Okay.
Okay. All right. So I'm gonna just clean you off. It's gonna be real, but I'm not going to put any needles,
Okay.
in,
Poker.
Okay. So how do we clean? Starting in the
Inside,
middle,
and then work our way out.
circular motion, 1 to 2 inches approximately, 1 motion. Okay, just like so. All right. So we're gonna let that air dry. I'm gonna go ahead and get rid of this. All right, so you need to use what we call Z-track or hold it taut. So you can pull it down, pull it to the side, or you can spread it. Do not touch the area you cleaned, okay, because you just cleaned it, okay? So I'm gonna go ahead and spread it apart, like so, okay? So I went ahead, I removed my cap, spreading, holding it taut, using Z-track. I'm gonna go in at a 90-degree angle in a dart-like fashion, okay? So I'm gonna go 1, 2, 3, in, inject. If you noticed, I removed my hand. I'm gonna keep my hand, hold my needle steady, come out, same way I went in, engage my safety, massage, Band-Aid.
Question. I thought it said don't massage because then.
That's for intradermal.
Oh, okay.
Okay? Questions? Okay. For subcutaneous and intramuscular, you're not injecting each other, it's just air. Okay? ID is the only one where you're gonna actually inject each other. Okay? Alright, so I'm gonna go ahead and I'm gonna go ahead and walk you through the rest of this skill, okay, of everything you need to say. And then Ms. Pearson's gonna come in and just show you the technique for ventrogluteal, okay? All right, so we are all done. So when you activate this, you just push it up and it clicks. How are you feeling, Miss Smith?
I'm feeling good, baby.
Okay. I'm glad to hear it. So, a couple of things I do need you to be aware of. Any localized swelling, pain, redness, rash, or just give our office a call. Anything worsening than that, like any systemic reactions, trouble breathing, heartbeat irregularities, trouble swallowing, abdominal pain, call 911, go to the ER. Just know that localized mild to moderate pain is expected with injections, okay? Do you have any questions? Okay, so I do need you to wait about 10 to 15 minutes to make sure that you don't get an allergic reaction or any side effect to the medication we just gave you. Are you okay to wait 10 to 15 minutes? All right, great. So I'm just gonna get this off the floor, get all my things, and then I'll be right back to check on you, okay?
Okay.
10 to 15 minutes passed. Not bad.
Yes.
All right, how are you doing?
I'm doing good.
All right, you look great. I'll go ahead and walk you out. Walk out the patient.
You didn't hold my hand.
Oh, my God.
I did.
All right, and that's it.
Must be my patient. Okay. Wait, I have to show you my butt?
No, but you have to lay on your side. No. You said my side. Not deep like what you're doing right now. Okay, so you just have the patient rest there. So the easiest way for them to do it is for them to be on their side. No matter their size, you should be able to find the joint on the hip there. So I'm going to demonstrate how you would kind of locate it. So I'm going to lift just your scrub top here. That's what I'm going to do. Now you guys are going to have to come a little bit closer if you want to see where. So usually, so you can kind of feel where her iliac crest is, which should be right here. Do you feel me pushing it?
Yes.
Okay, so you're always gonna make your patient aware of what you're doing. So then when you're wording it, you say, okay, I just need to make sure I'm going in the right spot. Don't phrase it like that. You wanna phrase it as, okay, I'm just gonna press on your hip area here so I can find my placement.
Okay.
And that's kind of how you would phrase it, okay? So you use your palm of your hand here, and you could feel like the joint, where the hip joint is, okay? And now if you put your fingers up there, you should be able to feel that iliac crest. So if you are down here and you put your fingers up, you're only going to be feeling tissue, muscle area. You're not going to be feeling that iliac crest. I like to say crust, but it's crest. So crest is right here. So she can feel me pushing it, right? Yeah. So you can feel the bone there, okay? So if you lay on your side, you should be able to find it. You can find the main part there, and then your thumb is facing the groin. And then once you have your hand on there, I feel my crest, you're gonna make your V. See my V? Okay? And then right here, so when I usually grab my alcohol swab, getting my placement, feeling my crest, making my V. Yep, and I'm gonna go to the higher peak of my V over here. So it's kind of like right in this area. I just lay my little gauze there for a second while I'm getting the rest. I'm just gonna squirt them so you guys can see. Okay. All right. Again, I already have my placement. It's still good. You could double check it again. I've already cleaning my area. You're going in at a 90-degree angle. My bevel is up. Bevel is the same with my little safety clip here. You're going in at a 90-degree angle. You're coming out at a 90-degree angle, okay? But you can kind of use your alcohol swab to mark it if you want. If you just want to lay it there, when you come back, you can clean your area, give it a second, give your injection, come out, okay? And then usually I always have my gauze in the other hand so I can immediately put my pressure on there if you want to. Sometimes, you know, if there's a little drop of blood or some of the solution coming out, that kind of thing, then you have that to apply there. Any questions? But I'll get used to it. So you just make your V, you have your thumb pointing to your groin, your palm, your joint of the hip should be sitting at your palm. And when you put your fingers up there, you should be able to feel that crest, okay? If you're down too far, then you know you're not pressing on the crest there. You're gonna feel it. Y'all should be able to feel where the top of your hip bone is. That little curve, that's your crest. Okay, so if your fingers are laying there, your palm should be right there on like the actual joint of the hip. And then you just make your V, your wide V. Okay. And then you're just going to the right of your V. You don't want to come towards the groin with your injection. You're going to the right of the V. Okay.
Let's say